ChatGPT is leading us well so far, and the next thing that we want to talk about is the fifth thing on the list, which is myofascial restriction and trigger points. Now, it's not wrong, but the problem is that we're going back to that root and fruit. There is no such thing, in my opinion, as a myofascial restriction or a trigger point that is not preceded by some other mechanical dysfunction. That is usually the myofascial stuff, and the trigger points, the muscle issues, those are usually secondary or because of some kind of joint dysfunction. And the reason why this is that we don't normally have some kind of basal or baseline tone in our muscles. If you're completely flaccid, you've got no tone, and if you're hypertonistic, you have more tone than you should. A lot of times that hypertonistic state is usually going to cause trigger points and myofascial restriction. You can go back to the massage and do the muscle work and the soft tissue work, and if you keep doing it over and over and over again, my question to you is, when are you expecting it to work? Because the reality is people keep getting treatment, muscle work, and it's still there. When at the trigger point, I still have that trigger point. Well, at some point we got to figure out that maybe we're not treating the root, but we're treating the fruit. We got to ask ourselves, why did the muscles get tight? It's usually a reflexive protection of joint dysfunction. So when your pelvis is out of alignment, or that facet joint is not working properly, or a disc has been injured, the muscles go, hey, tighten in. Protect this thing. And when it protects it, that's a good thing for a time, but sometimes the body just doesn't get triggered to release it. And when it doesn't release, now you have a healed disc or a facet joint that kind of got back to normal, but the muscles are still tight. And when the muscles are still tight, you usually have to correct some of the mechanical joint dysfunction problems first, and then a lot of the tone just comes straight down.